Welcome to Things My Mother Forgot to Mention.
The podcast where we say everything our mothers didn't.
I'm Jan, a trauma therapist and author turned rogue storyteller, here to talk openly about the body, aging, and all the, wait, what? Moments of womanhood.
And I'm Patty, an online business and tech nerd whose purpose is to elevate the voices of women in our world and who doesn't believe in taboo topics. Things My Mother Forgot to Mention is the podcast for every woman who's ever said, wait, why didn't anyone mention this to me?
Join Jan and Patty, two outspoken, curious, outrageous women, as they dive headfirst into a messy, magical, and often WTF realities of aging, health, and quite simply being a woman.
From rogue chin hairs and vaginal thinning
to mental health, perimenopause, and scalp cancer. Yes, really.
Nothing is off limits. It's funny, it's raw, it's real talk your mother definitely skipped.
Let's get into it.
Hi, Jan.
Hey there, Patty.
How you doing?
I'm doing better. Yes.
Yeah?
I'm doing better. Thank you. Yeah.
Good. Good. Do you want to share what you've
Well, I just 10 days ago I ended up having a knee replacement, partial knee replacement, and it's for any people out there that have to have your knee replaced. It's much more challenging than hips or anything that I've experienced before that. So just a heads up for people. So I'm
Yeah.
still in the throes of it, but
Yeah.
much
Yeah.
better. I've turned the corner. You turned the
Good.
corner.
Well, I hope that it continues to get better and you have
Thank you. Me
less and
too.
less pain. But today we are kind of doing a follow-up on the episode we did a few weeks back, where we sort of chatted about some of our dental horror stories that we've experienced. And now we have somebody joining us who's an actual dentist to share information about his experience becoming a dentist and what he sees and resources he likes to share, all of that. And so today we're talking with Dr. Zakary Yermolenko. And he is a general dentist and owner of a family practice known as Vernon Valley Dentistry. He is a major in the U.S. Army Reserve, where he serves as a general dentist as well. He is married with two children, and the family has two dogs, two cats, and 10 chickens. He enjoys watching, playing, and coaching soccer. Welcome, Zach.
Morning. Pleasure to be here.
Welcome. 10
Yeah.
Thank you for
chickens.
having me.
Tell me about that.
It's the wife thing. She wanted chickens, and we got chickens. She grew up on a farm in Poland.
Nice.
Just wanted to be, reminiscing about that, and so we got 10 chickens. It was a process, but we have them now.
I bet you get a lot of fresh eggs then,
Oh, yeah.
obviously.
10
Oh,
a day. 10 a day. Yeah.
wow. That's great.
Amazing. So tell us a little bit about how you got into becoming a dentist. Is that something you'd always wanted to do, or what did that look like for you?
So my father was actually a dentist. He became a dentist in New York, where we lived, and so he didn't necessarily force me and push me into that profession. But growing up and seeing him do what he does, I really enjoyed it. Not only the dentistry aspect, but also the lifestyle aspect of it, where he had the autonomy to do what he wanted in terms of the scheduling, in terms of how he ran his practice. And so that's something that while growing up, I experienced, different jobs here and there, working at a pharmacy or doing other things. And so I realized that dentistry is probably something more that I'd be interested in doing, not only for the dentistry aspect of it, but for the lifestyle of it, because I think it's important that we not only love what we do, but that we enjoy life outside of what we do as well. And that's one of the things that I thought I'd be able to get with dentistry. But aside from that aspect of it, yeah, I liked, the responses and the treatment that, my father was able to do, and the appreciation that the patients had. I enjoyed seeing that from my dad's point of view. That's something that I also wanted to contribute. So that's why I chose dentistry versus another profession. So kind of both things kind of helping make that decision, really.
Yeah.
I think that's wisdom that you said, to enjoy what you do in your work as well as having a life outside of that.
Yes.
Yeah. Yeah, absolutely. And so So did you work in other practices first, or how long have you had your own practice, or did you like take
Right.
over a family practice?
Right. So I graduated in 2018 and I started working for a mom and pop shop for a specialist known as a prosthodontist. They specialize in crowns and bridges and implants and dentures. He also specializes in jaw pain, so he takes care of them that way, the patients that way as well. I learned a tremendous amount from him, and not only again the dentistry aspect of it, but also the business aspect of it, and the family rapport as well. That's extremely important. That I wanted to establish in my own practice. So that was in 2018. I worked also in another practice as well, a little bit more busier, fast-paced practice that I appreciated to receive the speed that's required in dentistry because I'm sure nobody wants to sit for a 4-hour filling, So I appreciated that as well to get that experience from that office, and then I worked in other offices throughout my career where I gained a little bit of value and understanding and experience of what I would expect that I would want. Because the end goal was always to have my own practice, kind of like my father. And so gaining from them their dentistry skills that they were able to teach me and mentor me along the way, as well as the business aspect of it, not just in terms of the insurances and the finances, but also like once again the family rapport and
Right.
even their lifestyles. I was able to learn from them what they do outside of dentistry, because once again, as I mentioned, dentistry is just a thing that we do in order to live life, to how we please, right? So I learned a lot from them as well. I have a dentist in town. He's actually a pilot also. That's pretty cool. So yeah, dentists are once again jack of all trades. They love doing everything. We
Mm.
love doing everything. We're very handy. We try to be handy. Obviously, some things we're not good at. That's when we hire people. But
Yeah.
you might see us thinking that, oh, we can fix this, a sink or whatever. It's like we can do a root canal. We can fix a sink. But yeah. So I was very happy to have the experience that I did prior to applying my practice in August of 2023. The story is actually was my son was born August 4th, 2023, and we bought the practice August 5th, 2023.
Oh,
That was
wow.
a Friday and a Saturday, and then Monday I started working.
Oh,
So
wow.
it was quite an interesting, quick. He was my second born, so not to say that that doesn't matter, but it's kind of like it's
It was
fine.
less of a big deal.
Exactly. He was born. Let's go back to work. Wife stayed home, took care of the kids. So, yeah, and obviously we had to run the practice. So it was very fast paced, but we got it up and running, and we have it going the way we want to, and still always room for improvement. And yeah, very happy with it.
So you probably learned a lot when you were growing up from either your mother or father, probably father,
Mhm.
about how to take care of your teeth and how important that is. Is that true? I mean,
Yeah,
because
absolutely.
that's what
Yeah,
we usually look at is what mom forgot to tell you about or dad.
yeah.
And I'm curious if that probably didn't come across in your family, right?
So what's really funny is that my mom wanted to do absolutely nothing with teeth. She's like, leave me out of it. I don't want any business with it, anything to do. She was a computer programmer.
Oh,
That's what she did. So she did not care. I mean, she took care of her own teeth and all that stuff, but as far as dentistry goes, she did not want anything to do with it with my father. So she stayed out of it. But my father, yeah, like he reminded me to brush, every day, at morning, at night, floss, all that stuff. I don't know if you had back in the day, we had like a little like they have it now for applications. You can download the Crest app, whatever, and you can follow along, making sure that the kids and even ourselves are brushing our teeth. It has like a tracker. Back then we had a piece of paper that we printed out and then mark on the paper an X. Okay, we brush our teeth today, or put a sticker today. And so my dad would always make sure that that's done. Then there's a secret that I like to tell my patients that are the parents of children. The way you can tell a kid brushed their teeth is if the toothbrush is wet. Okay, so that's another way that I made sure that my dad would know, like if I just wet the toothbrush or not. It's like you can't spend 5 seconds brushing your teeth. It's got to be a whole 2 minutes. So if I just went in there quickly, rinsed the toothbrush with water, he'd be like, no, no, that was only 5 seconds. Go back in there and brush again. So that's one thing that if kids are not doing their due diligence, usually around teenage years. I just remind the parents, hey, check the toothbrush. That's the trick that my dad taught me, and that's kind of what I'm relaying to the patients' parents as well.
That's
yeah.
great.
Yeah. So now that you've been a dentist and sort of experiencing your own, like having pretty solid, it sounds like, oral hygiene as you were growing up. Have you noticed then a massive difference in your own, as far as your need for any serious dental work or anything like that because of preventative care versus people you're seeing in your practice that might not grow up with somebody teaching them really good hygiene practices?
Luckily for today, I do think we have more resources available to us, and there definitely are more programs available to students and kids and even adults. Even when I was in dental school, there's like Give Kids a Smile, and there's town days. We had just one last weekend called Sparta Day, where the town brings together all the local businesses and kind of have a fair and promote the businesses. And there were at least 3 or 4 dental businesses out there who are promoting oral care, and they obviously give promotions and their products. So I think availability is more so um, at an advantage today than it was back then. Whether or not that's because we care more than we did before, or whatever the case is, I do think that we are steered and geared more towards now being able to receive that care and resources than we did before. Again, it's just I see it on even on kids shows. I don't know if you guys have
Mm.
seen like even whether it's Coco Melon or other shows, they have for kids is just brush your teeth and they sing along to that song. So
Yep.
I do think like when I grew up, I don't remember and thinking about it. We didn't really talk about it. We had like other interests, whether it was going outside, playing outside
Right.
you know but now, so whether it's because I'm a dentist that I see it more. And I don't know if you ever realize that sometimes also when you purchase a new car and then
Right.
you're driving around, like, and then all of a sudden you see like, oh man, a lot of people have the same car.
Right,
So it's like,
exactly.
so it's kind of like, oh, I'm a dentist. It's like, am I just hearing a lot of these things around because I'm a dentist, or is just because like it's just readily available? So that's one thing that I'm personally at a disadvantage of, is because as being a dentist, like if I was a race car driver, would I be thinking about, racing and this and that more? And so I don't know if it's geared towards just my profession that I'm surrounded by it, that that's the way it feels, or it's in fact that it is actually readily available
Mm.
to the public.
Yeah.
What I was interested in, Zach, is uh, when I was asking you whether you were an endodontist, or if you,
Mhm.
you you mentioned something else. Is that how it is in the 20th century? I mean, I'm a little bit older than everybody here, and
Mhm.
we had as kids we had this dentist, and specialty when something would go wrong, they'd just be with the same dentist. And I'm wondering if, and as the years have gone by and technology's changed for teeth and what you use for teeth and all that, and Invisalign, you name it. Is it changing? Is it still being really kind of just like an orthopedic surgeon does knees, this one does shoulders. Is that how dental care is or not?
Yeah, yeah. So in dental school, we learn the basics of everything. We have to know we're licensed to do anything and everything within the realm of dentistry. Now, if there's a complicated procedure, per se, like an impacted wisdom tooth, or a very poor bite that somebody might have, in terms of braces, we would then refer to those specialists where the general dentists graduate dental school, and then they take on a residency program in that specialty for however many years it is, whether it's 2 years, 3 years, or even up to 8 years, um, to specialize specifically in that. So dentists are capable of reconstructing a whole face per se if they're involved in, God forbid, some kind of accident or some kind of trauma. Um,
Mhm.
so yeah, so within limitations, a general dentist can do as they please, but if their skills, they know that there are limitations, then they will refer to us to a specialist. And even so, even though we do have specialists, believe it or not, those specialists sometimes say even they are not able to do it, and they would refer to another specialist. So it's
Wow.
not that, just because a specialist is able to do a certain procedure because they were taught to, sometimes it's so complicated that it needs to be referred to somebody with even greater experience, or knowledge or education, or even resources within that treatment that they're providing for the patient.
Yeah,
Mm.
because one of the things, I'll just briefly share this, is
Mhm.
I had 2 weeks ago, 3 weeks ago, time has gone by. I went for a cleaning, and all of a sudden this dentist says, "Oh, your gums are really swollen." She takes an
Mhm.
X-ray and she says, "Oh, I think that tooth has resorption." So she sends me to an endodontist. Okay, so I go to an
Mhm.
endodontist, and basically the root canal that was done wasn't done correctly. It wasn't done deep enough. And resorption, according to what I learned reading reading Chat GPT and anything else, it said basically it's how the body attacks part of your it's like an immune system disease. It attacks the roots on certain teeth, and that the tooth, if it was left alone, would eventually need to be pulled and an implant put in. So I was like, oh my gosh, I'd never heard of such a thing. In fact, I tell my friends, and everybody's like, what? That's crazy, because it already had a root canal and a crown on it.
Yeah,
So
yeah. Google is a scary source.
it can be. But I do think that some of that's true, because then when I did ask the endodontist, what is this exactly? He said, we don't really know why it happens.
Mhm.
He said, but basically it what happens is that the roots end up being kind of dissolving and yeah, I don't know, actually you lose the roots. I'm not exactly sure. And then what happens is you lose the tooth and then you have to have an implant put in and a tooth on it. So it was done, it was quite a process for me. I had done that in years. So do you hear that because when we were talking before, we're talking about all the issues that we had with different root canals that we had done or whether it was done correctly. So do you see that a lot in your practice?
Not a lot, but the beauty of dentistry is it's a type of science where it's the body. Everybody's body is different. Everybody's response to anything in life is different, whether it's diet, whether it's exercise. You can be completely healthy, you can be not healthy, and then one person has conditions and the other one doesn't have conditions, whether it's high cholesterol. So there's infinite amount of possibilities and outcomes to why things happen, and then how to address it. So it's nothing, put it this way, can surprise, at least me, nothing surprises me, because it's just part of life. And our goal as dentists is to make sure that we are able to do basically two things: stay away from infection and stay away from pain for the patients, right? Everything else will come into play, whether it's function, right, restorability, and obviously the preventative, right? So those are the things that we look to accomplish. So it's not something that is written in stone when saying many people or not that many. There's no right or wrong answer or value to it, just because it's just human nature and just nature in general of how things happen and occur. So when you're saying the resorption, yes, all that is a science. That's correct. I don't know about have to put an implant in. It's a whether you want to or don't want to, right? I always tell that to the patients. I always present multiple options and tell them whichever one you go with. These are how I think of it and how I present it. It's always an autonomous decision by the patient,
Right.
unless I specifically say this is an infection. Right. For me,
Hmm.
number one is infection. Fight infection, as I was mentioning. With infection, not necessarily does come with pain, but can come with pain. So those are the things that's my baseline. It is to make sure every single patient does not have infection and does not have pain.
Right.
Pain does not have to deal with infection. Infection does not have to deal with pain. It could be trauma.
Hmm.
I have had in this practice, surprisingly, a lot amount of people, or patients, I should say, with jaw symptoms, jaw pain, sensitivity in their teeth. I've noticed a lot more. I think whether it's in the past 6 years with everything that has happened, just globally or even personally, clenching, grinding, a lot
Yes,
a lot of stress.
grinding.
So I think that's a big factor. So whether it's a wave of happening right now due to, again, whether it's in house or just what's happening in the world and all that stuff, I don't know what the correct answer is. But what I see is that now I do have patients that have a history of it as well, right? So I tell them, listen, I don't know if you're still doing it or not. So I mentioned them to that as well. As like, it's that's one thing that I can notice is with dentistry, there's no right or wrong answer in terms of the resorption and all of things, how they happen. But as dentists, we just have to figure out the best way to treat not only the effect, but the cause. Like, it's also important to diagnose correctly, so patients can come in and I can see that they're grinding, and some of the things I might ask them, believe it or not, is do you have sleep apnea? And they're like, oh, I don't know. I said, have a sleep study test. And then lo and behold, they come back with sleep apnea, and they would need a device, whether it's a night guard, a different type of appliance, or even a
Right.
CPAP machine. So it's important that the diagnosis is correct, as you were mentioning with the resorption, um, that it's treated correctly and monitored correctly. In your case, if the specialist says or recommends, taking it out before it completely dissolves, then that's approaching it so that it resolves that issue,
Mhm.
right?
Yeah,
It's
it
that.
actually ended up being I ended up having this X-ray that went around my whole head where they place your
Mhm,
head. So that's when they could really see it. So I knew they knew what they were doing then. And,
mhm,
so I paid for that. And then they said, okay, so if we get this early enough, we'll keep the tooth. But if you don't do anything, because it already had a root canal and a crown on it, and
yeah.
I didn't feel anything was wrong. And that was the whole
Mhm,
thing. It was like, I'm like, what is he talking about? So, but
yeah.
anyway, the amount to me, I'm always blown away by the technology of this
Mhm.
of dental work and how
Mhm.
far it's come from when I was going as a little girl, like 50, 60 years ago.
Yeah, so technology has definitely advanced. Some of the approaches and treatments might be similar in terms of how we approach it, right? Whether filling is a filling, a root canal is a root canal. The technology has changed. The 3D, most likely, is a 3D scan to determine, the overall outcome of what's going on. The one thing you mentioned, which I find it needs to be addressed or approached very carefully, is, and a lot of patients say as well, oh, I don't have pain,
Mm.
right? So that, as I mentioned before, it can be from trauma, right? The tooth could have had trauma, whatever the case may be. But pain should not be something, and for patients to associate, that's when they need to go and be taken care of, as mentioned with the
Right.
preventative care, right?
Hmm.
So not just dental, but overall healthcare,
Overall,
right?
yes.
If somebody is experiencing pain, means it's not necessarily too late, but they might have neglected something. And it could be even related to house, to the home, to the car,
Mhm.
right? If something goes wrong, it means we're not doing our due diligence of maintaining things, because things break down,
Yeah.
whether it's an appliance, anything. So usually the way I kind of approach it with patients, and not to scare them, but to kind of give them, a little heads up, is, high blood pressure, you don't feel that as well until it's too late,
Right.
right?
Yeah.
So the diabetes as well. So you don't feel these things with elevated sugar levels or elevated blood pressure, and even lowered blood pressure. So it's important that, um, for people to understand that our goal, is, as dentists, as my goal is preventative. I don't want to do all the work in the world. It's not my goal. My goal is to prevent infection and pain. If you come to the office and you have no pain, infection, then my job is not necessarily done, but at a stage where now I can just continue to prevent it from happening.
That's important. And that's what, preventative for everything, especially when you get into your 70s, everything starts falling apart. And it tells you if you haven't taken care of it way back here, this is
Right.
going to be some issues you're going to have here. So I
Yeah.
think
Right.
that's a great way to look at the body and, of course, the teeth too. So
Yeah. Do you have any like favorite aspects of dentistry, or like favorite treatments or anything like that that I know as a nerd in general of like tech and stuff, there's certain things I
Right.
love doing more than others, but in your job, is there something you enjoy more than something else?
Honestly, in terms of dentistry, no. I do like, with the kids, it's pretty fun, especially when they're younger, just to like talk to them. It's just, when I was a coach, also for soccer, and this is
nice.
prior to dental school, and college was tough. I was working in a pharmacy, um, so it was a lot of things going on. And once trying to get into dental school, it was a stressful time. The one thing that kept me, like, and this is one of the interviews I had at a dental school that I spoke to the interviewer with, is that one thing I had was that release of stress and anxiety with the kids. When I was
Mm.
coaching them, they were 4-year-olds, and they were just out there living like the moment.
Yeah.
The games, like we played red light, green light, and cones up, cones, all those fun games we played. So, and actually, small world, I guess, it's back in a circle. I'm now coaching my daughter as well. She's
Mm.
5, so I'm coaching her as well. So I'm back in that same stage. But in dentistry, as you mentioned with the question, it's the kids that are just like, seeing them, hey, so how's school and this and that. And, they tell me what their favorite color is, what their favorite, you know, um, action hero is, or whatever the case may be. And if they brush their teeth, and it's just, that's, when you start them also young, they appreciate it more. I think it's also, what's important is that kids are taught that dentists are good, not bad. And that's the
Yeah.
one thing that I've noticed. Sometimes parents will be like, oh, you're going to the dentist, make sure you behave. If you don't brush your teeth, you get a shot and this and that. And those are the words that I avoid in my office. I avoid
Right,
certain words. We
right.
don't say the pain word. We don't say the shot. We don't even say the word long or wide, because all these are trigger words for patients, whether they're kids or even adults. So it's also important to listen to the patients, to the kids, and to the adults, because they'll tell you exactly what's going on in their mouth. And I've had kids where, they're not doing a good job of brushing their teeth, whether it's, because they're young and they're not able to do it, or the parents aren't able to help them, or also not know as much.
Yeah.
So my goal is to improve their care with them and with their parents.
Mhm.
And again, listening to them really helps me understand the most important thing is the preventative why it's happening,
Yeah.
right? It's why do you have a cavity in your mouth? Is it from eating too much candy? Is it from not brushing your teeth at night? Is it from not brushing your teeth at all? So it's the thing is, it's always comes down to oral hygiene, and diet is an extremely important factor, aside from it being also a possibility whether it's an autoimmune condition, which you can go into great
Yeah.
detail, but it's not necessary. The point is that for me, it's the kids that I really enjoy the dentistry aspect of it, because it just frees me from thinking, okay, I'm a dentist, but at the same time, like, I'm talking to kids, and so
Yeah.
it reminds me of just the simpler times in life.
Yeah, absolutely. So, talking about then preventative measures. So, I think everybody hears, brush and floss. That's important multiple times a day. So, what do you then, as a dentist, recommend? What is the best preventative measures that we can take so that we don't end up with more challenging dental issues when we get older or anytime, really?
Right. Brushing, flossing, I don't necessarily recommend in terms of my office, but you can more than welcome. I always tell patients you're welcome to, is rinsing. Water pick, again, it's an option. For me, the bottom line is it's gold standard has to be brushing and flossing. It has to be 2 minutes a day, twice a day, flossing again twice a day, minimally. For every time you don't brush, it goes one step forward, two steps back.
Mm.
So if people come in with a lot of buildup, it's because you missed that one layer of plaque, and therefore that now becomes it's kind of like brick and mortar. When you put down a slat of cement, that's it. That's going to stay there. You're not able to brush that one off. The next day, you go ahead and start a new layer of plaque, and then if you brush that off, you're good to go again. If you don't, that builds up, and so every time it's missed, that's where the buildup comes in, and that's when patients come in and they're like, "Oh, I have a lot of buildup." We usually tell them it's more from that. Now, you do have patients that are doing their due diligence, and they just build up just because that's just how it is in nature. So if they didn't brush and floss every day, it can only be a lot worse. All right. There is no true study that says mechanical or handheld non-electric toothbrushes are better. It does not say that. However, every time that I've noticed that patients do invest in an electric toothbrush, they do a better job of brushing their teeth, whether it's because it's timed or because there's that mechanical motion, whether it's rotating or the vibrating kind of toothbrush. It just seems that it's just better overall in terms of when they come in for their recall visits, their overall care. So there's that aspect of it. Diet is a huge one, as I mentioned before. Carbs, anything sticky can cause cavities. Can cause inflammation of the gums as well if the plaque builds up under the gums. So those are things that I remind patients is you got to keep a healthy diet. Everything in moderacy, right? But a healthy diet is extremely important. Lots of water is extremely important. Um, what else is there? I mean, that's the base of it. If there are conditions that patients may have, whether it's dry mouth due to medications or autoimmune conditions, I do recommend for them lozenges or mouth rinse that's readily available over the counter. Um,
Mm,
if their gums are inflamed, it depends on the severity of it. There are prescription strength mouthwashes, mouth rinses available, as well as over-the-counter ones that help prevent the condition from worsening until they see us and take care of that. How we need to take care of it.
yeah.
Uh, Other preventative measures, obviously seeing the dentist twice a year, or at least twice a year is important, depending on everybody's oral health care needs.
Yeah.
One thing that Jan mentioned, that she had the surgery. Um, a lot of providers that are doctors or surgeons not necessarily forget, but don't always remind their patients. And there is always studies going back and forth about this. Pre-medication moving forward, depending on the procedure, even for things such as cleanings, it's extremely important that you find out whether or not you need to be pre-medicated moving forward for any kind of dental care. Reason being is because we have billions of plaque in our mouths, which is bacteria, and if that ends up in the bloodstream, it can end up, if the replacement is an appliance or an apparatus, if you have like a rod or anything like that, there are studies that we want to make sure that that's prevented to not escape and wreak havoc in those areas.
What is I don't know what pre-medicating is.
So it's basically just a loading dose of antibiotics
Mm,
prior to any treatment or procedure completed, in order to not allow the the infection to spread.
okay.
Because as mentioned, there's billions of bacteria in the mouth, and there's blood streams right then and there. If you've noticed you're brushing or flossing and there's sometimes bleeding, that plaque can go through the bloodstream and end up in different parts of the body. So we always, take our preventative measures, especially with surgeries, to make sure that that doesn't happen. And studies are always coming out whether to continue doing it or not doing it. And that's another thing that we learned in dental school that I don't remember whether or not it was a thing in the past, but inner communication within the other professions, not
Yeah.
just the nursing or the primary care physicians, but the orthopedic surgeons or neurologists, neurosurgeons, cardiologists. It's I have patients coming all the time with all these conditions that I say we need to have medical clearance. And I understand from the patient's aspect and point of view, it sometimes is they don't usually complain. It's not frustration, but it's just an extra step that they have to take,
Yep.
especially if we want to get something done quick and fast. Like, oh, I just want this thing filled. Listen, I understand, but we need it to be preventative, measures.
Yep. Yep.
It's an
Yep.
important thing that we want to make sure that it goes smooth, and that,
Yes.
and as mentioned, the most important thing is free of infection, free of pain, right? And those are the preventative things that we also look into in order to make sure everything goes smooth.
Yeah.
Yeah. Thank you. Yeah, I agree.
Yeah. So when we look for dentists, what advice do you have on what the best, how to best look for a dentist and identify what a good dentist, like I had a dentist recently, in the end wasn't really that great of a dentist, but are there things that we should be looking for, or what kind of advice do you have, if you have any, on the best way to identify a good dentist and what traits they might have?
Word of mouth is a huge one, whether it's literally word of mouth or Google or Facebook, social media, not from the standpoint of the dentist, but the standpoint of the community. Right? That's an important thing. I can never tell you who is going to be good or not good, because it's not just about the dental skills. Obviously, that's number one, but the rapport as well is important. And sometimes you cannot do so from the first visit. Just determine whether the
Right.
dentist is in fact, trained and skilled enough in the treatment, or whether or not they have that warming, welcoming environment as well, because everybody wants that as well. We're all human beings. We want to make sure that we build, as I mentioned before, a rapport with the patients, and obviously the care has to be there as well. So for me, for somebody to look for a provider, whether it's a dentist or anybody, it would go through the community, somebody that you trust, whether it's a family or friend that they would necessarily go see and say that they've been, even it could be a 1 year thing, it could be, you know, a 10 year thing, 20 year thing, whatever the case may be. And even then, I can tell you right now, because this has happened recently, within another town, within my county, there was a huge report from one of the posts, a long thing of complaints from an office, and then underneath were hundreds, I think, of comments going back and forth, and mixed comments, mixed reviews, and that can go even for social media, it can go for Google, and it can go for friends and family as well. So once again, in dentistry and just in life, there's no right or wrong answer. So it's kind of the trust that you would have to have with the resources that are made available to you. So that's, to me, the best way to do it. And that's one of the things that I always have a challenge with every single day. Not every single day, but quite frequently in, well, with every single new patient. That's the best way to word. With every single new patient, they say, "Oh, I had this. I didn't have good experiences." I had one patient right out of dental school. The office I worked for, that she told me that every time I came to the dental office, I always had the laughing gas. She said, I always had a laughing gas, always a laughing gas. No matter what, I said, okay, we'll do that. I told him, listen, if you want it, we can do it. Usually I don't do it because it's just a filling. They're like, no, I always have it. And then we gave the laughing gas, we did the filling. As soon as the treatment was done, the patient said, don't worry about the laughing gas anymore. So in other words, it's how the dentist is able to treat with chairside manner and the work itself.
And that brings up another question for me along this lines. I'm a therapist, so I work with people who have a lot of trauma. And I can't tell you how many people come into my office that have had trauma. And some of them, and I actually felt some of it myself because I've had some trauma, is, they lay for the endodontist, I'm like laying out almost in a slant with this big Zeiss machine over it, and then two people, their faces here, and a dam on my tooth, and I had a panic attack. I like started freaking out, and I told her, I said, "Hey, look, before we start, I just want you to know I'm claustrophobic, and I have a prone to panic attacks." She's like, "What? Well, what's that?" I thought she was not trauma informed. I even tried to talk to the dentist about it, and to me, that's really important because some people who have been sexually abused or something, they're gonna really have a hard time with people like leaning on them and covering them with all these things. So that if I were to pump for anything,
Mhm.
I don't know if they educate them in dental school, but that is an essential thing because it brings back all those memories. So anyway,
Yeah. We have that in dental school, the training for that. I've had experience of that in private practice, where a patient came to me with a history of sexual abuse from another dentist. So it was
yikes.
something from, so yeah, so I was able to calm her down. I left that practice, but she became a very good like a patient, and if you will, a friend of mine. That you have to rebuild that rapport. So that's the things I
Right.
mentioned. Is the challenge is with every new patient that comes in, not every new patient, but those that have difficulties in the past or whatever the case may be. And even if you could have had a great experience, and I was like, oh, now I have to go to a new dentist, right?
Yeah.
So it's rebuilding that. And I don't, that's a challenge that love to attack, right? That I
Yes.
love to to to
To
to be
heal.
challenged with. Heal. Yeah. So yeah, um it, in terms of what you were experiencing, that's a not an uncommon thing. Reason is there's a thing called, and you can Google it, it's called a homunculus. We learned it in dental school. The mouth is the most sensitive part of the body, you know. So when you're leaning back, you feel very
Exposed,
exposed. Correct. So
vulnerable.
vulnerable. I think that's the word. So that's the one that it's not uncommon to see. And I always tell patients, this is what this is what you can expect. Okay, I'm gonna get you numb. I always let them know it's not best to jump into things without explaining it to them. Now, how I approach them with like the anesthesia, I'm not going to show it to them because obviously they think it's this enormous piece of apparatus that is going into their mouth, and that's never the case. So there's ways to approach patients with that fear of dentistry, and it's called white coat syndrome. That's just what we were taught in dental school. And when we check for blood pressure, it's out the roof. And it's in the numbers where we say, listen, you probably should go to the ER right now. And they're like, no, just because I'm here. I had some coffee before, and we're like, listen, let's give it a few minutes. And so we reevaluate. But the dental offices, for some reason, impose a very uncomfortable, unsettling type of environment, whether it's from the past or from hearing things or the horror stories as you were mentioning. I try to eradicate that completely the best that I can, whether it's the office the way it is, with the staff the way we are, and obviously myself as well. I always maintain a cool and calm collective environment as much as possible so that the patients can feed off of that as well. I have patients when they get their fillings the first time, and it was yesterday, and I let them know this is all you're gonna feel, a tiny pinch, and the rest is whatever I have to do, I'll do. And if they say like, hey, can you tell me what you're doing? I'll tell you what I'm doing. It doesn't matter to me. It's whatever makes you feel comfortable. I had to the point where they fall asleep in my chair, and then I have to tell them, all many times, open, 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 and at all ages. Kids come to me after school, and this 12-year-old kid would just start falling asleep. I say, open, open. So as long as I'm able to do that, I think that's one of the biggest compliments a dentist can receive, is a patient falling asleep in the chair, as long as not from a medical emergency.
Yeah, seriously, too bad you're across the country from me.
Hopefully there's plenty of other ones around that provide some care.
Yeah, and that was a great question, Jen, because that was actually going to be something I was going to ask, is for people who have anxiety, because it is well known that people have anxiety with dentistry, is how us going in to see a dentist, the best way that we can prepare ourselves to stay calm. But I think you answered it, is making sure that you have a dentist who communicates with you. And if you don't have a dentist who's communicating with you and it's hearing you when you say, I'm uncomfortable. So for me, I have a thing with my throat. I don't like when they put things like instruments on my throat. And so I always am just like, you can put stuff on my chest, but don't put anything near my throat. And if they listen to me, that's great. That means that I have a dentist who's paying attention. And if I end up with things on my throat, then I'm like, I'm probably not coming back to you, because that was the one thing I said was could cause me to have a panic attack. And so I think that that's a really, like, you are showing a great example of somebody who is informed, who is aware, and I think reminds us that it is important to it is okay to have dentists who communicate with us, and that's what we want, as opposed to just feeling, because sometimes it can feel intimidating, which is also the white coat thing, is, well, in a person in authority, you should just listen and they know what they're talking about and all of that. But that doesn't mean that they can't have rapport, which you keep talking about, which is like a key word, and across everything you're saying, which I think is really important anytime you work with people. So I really love that.
Yeah.
Yeah.
Yeah. So another thing is, sometimes it's difficult with even those kind of patients, anxious patients. And I don't like to approach it this way, but there is even medications for it, right? Like we can always prescribe a Valium or Xanax for those patients, or even be seen. Some people say, listen, I just want to be knocked out, right? So I tell, okay, so we can always refer you to, and those are extreme cases. This is not your everyday, like, hey, this is anxiety, but I can handle it. Those are extreme cases. I just want to make sure that everybody's aware that there's different levels of anxiety, and even those that I didn't mention, the extreme cases, there's even for those um, treatment options for. So we have kids sometimes that come in with multiple cavities, and I can kind of tell right then and there, first of all, they wouldn't be seen by me. And even the pediatric dentist would say this would be a case for like a hospital setting, where they would be seen under sedation in order to do everything at once. Because that's another thing. As much as we try to make it a very comfortable environment, coming back multiple times for somebody, especially a child, it's probably best to be seen and treated um, in a setting where it's done, it's one and done, and that would be in a, and it's readily available. It's readily available in hospitals and dental schools. So it's the better option for all involved, for the dentist, for the child or the patient and the parent, um, to do all that as well. So there's different levels of anxiety, and I was just mentioning the ones that I approach it with, but obviously and I will always refer to who I need to. That's another key thing that's important in dentistry is know your
Prefer.
limitations. Know your limitations. Know when it's to refer,
Exactly.
because it might not sound pleasant at first to the patient, but you yourself are doing them a huge favor by
Yep.
referring to a person that will be able to treat them as they need to be treated, and making sure that they're diagnosed correctly, for the right care.
Yeah.
You know,
Right.
Yeah.
I
Yeah.
just want to ask you, I was just looking up, is the word homunculus? What is that?
homunculus. Yeah, it might be
Homunculus.
homunculus. I might be saying incorrectly. Yeah, it's a drawing, a cartoon figure of a human being, and how the the nerves work in the body. So if you take 2 points and you put it alongside a hand or a knee or foot, the body will be able to tell the distance of it. But if if the closer you get, they won't really be able to tell. But if you put 2 points very close to each other on the lip, especially, the body will be able to tell that. So it's more sensitive to things than the rest of the body. So that's how the mouth works. That's why another thing is why we're so sensitive when it comes to any kind of dental procedures, because it's
Wow,
so
I never knew that.
elevated.
Homunculus. Okay, I was just curious of
Hmm.
looking
Yeah.
that up. So
Yeah.
thank you.
Yes.
Yeah. Well, this has been so great and informative. Is there anything else that you were hoping to share that we haven't asked, or anything else that you'd like to say before we kind of wrap up?
No, I just thank you guys for having me on the show. I really appreciate it.
Thank you for taking the time. Thanks for listening to the podcast. If you like what you've heard, please share it with friends, subscribe, and leave a review.
And remember, information shared on this podcast is not medical advice. If you have a concern about your physical or mental health, please seek support from a professional.
If you have a story you'd like to share about things your mother forgot to mention, you can apply to be a guest.
We'd also love to hear a quick 90-second thing you've learned in your life.
You can find links to both of those over at our website at
thingsmymotherforgottomention.com or in the show notes.
Thank you.